This is Radio Health Journal. I'm Reed Pence. This week, one group that's endangered when everyone has to stay home: those who live with an abuser.
This just ripples. It's just going to have a rippling effect. And we are using Band-Aids now.
We'll talk about the alternatives that still exist when Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
The amount of meals that need to get produced have increased dramatically, and we're seeing that they continue to increase.
The challenges of providing free school meals to millions during this global pandemic. Then,
the best human solvers are still better than the best artificial intelligence solvers, too.
Adventures with crosswords and the puzzling people who can't live without them. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
The COVID-19 pandemic has left millions of Americans vulnerable in many ways, even if they're not sick themselves. The silent transmission of the virus has left some of us terrified of everyone else. Millions of those who've been thrown out of work or had their hours cut wonder if the government stimulus will save them from financial ruin. Healthcare workers with too little protective gear and too few ventilators pray that they and their patients make it through another day. And people trapped in abusive relationships worry that sheltering in place will make their home anything but a shelter.
We are actually receiving more calls, not so much about the escalation of violence, but the fear of the escalation of violence, the unknown that is a part of everything that's happening right now. The unexpected, unpredictable of everything that's going on now is intensified in an abusive relationship. And so it's the fear of what could happen.
That's Irene Lindsay Brantley, Program Director for Women in Transition in Philadelphia.
Abusive partners are finding more nuanced ways to wield power and control during these times because they have an audience. So the children are there, extended family members may be there. So abusive partners may not be using that physical force that they were using in the past. What's happening a lot with the calls and the clients that we have is emotional and financial abuse, especially during this time when people are out of work. If we have a client who managed to get out of an abusive relationship and then got laid off, and so what are her options? Is one of the options going back? So this just layers and layers and layers depending on where our caller or our client is in the process.
One way that abusers are changing their approach is to use pandemic headlines to make the world seem completely hopeless to those who might hope to get out.
They may be told, well, there's no help for you. You can't call anybody. 911 isn't coming. None of the domestic violence programs are open, and we are open. That's the message. We are open. We're providing services through phone, through text, through email. We're looking at providing virtual support groups. That's the message we want to get out there.
That's important because in a time of social isolation, there can be far fewer supports for survivors. Organizations are still there, but the supports that usually exist day to day are not. With no job to go to, for example, or having to do it from home, they may have virtually no break from their abusers.
There's like a fixed amount of time where there's no respite from that because that person's job, that survivor's job or their school may have been the only place that they felt valued or that they were receiving any kind of validation. And now there's a constant diet of name calling and put downs that are like planting seeds in the brain that maybe this is true, maybe I'm not going to be able to do anything. So after this is over, we all have a lot of work to do in helping to put people back together again.
And in an atmosphere of constant surveillance, now what used to be a few minutes away can become extraordinarily stressful.
Our caller or our client could be in an abusive relationship already feeling isolated before this even happened. And now there's an extra layer of isolation added onto that. So say survivor needs to go to the supermarket. Power and control has been the thread through this relationship. So now the power and control could mean, prove to me that you went to the supermarket. Why did you have to stay so long, knowing that there may be lines? So there's even an extra stress on just going to the supermarket.
An abuser's need for control ramps up at a time like this, and that makes the situation at home potentially worse in both predictable and surprising ways.
That's one thing that we know, that abusive people don't handle the loss of power and control well, because that actually feeds into what they need to exist. And the other part of that is they don't like being told what to do by other people. So they have government entities telling them what they can and cannot do. One of the things that we've seen is abusive partners disobeying some of the mandates that have been set. So they're actually inviting people into the home, having social gatherings, because they have this need to butt up against someone who's telling them what to do. And so then that's putting everybody in danger.
And if an abusive relationship is a tug of war over control, now the pandemic is putting survivors at a disadvantage.
The control that the survivor once had over this relationship, which could have been going to work, going to school, doing things in the community, are no longer there. So we work with the survivor. In what ways can they feel in control of their situation? We know that a lot of abusive people will use a person's medication or need for medication as a part of the power and control. We also work with clients who are survivors of substance abuse. That's really key in this situation, because they may not be able to, well, they can't go to an NA or AA meeting. The abusive partner knows that, can capitalize that, could actually provide drugs for them during this time, so that now they are using once again and more vulnerable. So this just ripples, and we are using Band-Aids now, handling things as they come up to try to help survivors be safe.
However, for some women, what's going on now is a wake-up call, as they're getting a concentrated dose of all the behaviors that may have gone on for some time.
We have clients who think they may be in an abusive relationship. Maybe this shelter at home, shelter in place, has made them realize that they actually are in an abusive relationship, and now they feel trapped and even more isolated. Maybe they're in, and we're safety planning about how to stay safe, how to keep the kids safe while at home. Maybe they just got out and then struggling with what resources are in place to help me stay out. And then we have family members who know that their loved one is in an abusive relationship. They can't go see them. They can't support them in the way that they've been traditionally supporting them. So this is more than just one lump of people that we're talking about.
And if someone who's abused might ordinarily seek medical help of any kind, or try to get out and go to a shelter house, Brantley says that's much less likely to happen now because of the fear of infection with COVID-19.
For a lot of our callers and clients, hospitals and doctors no longer feel safe to them and their children, and also residential programs no longer feel safe. They actually are feeling safer at home, feel like they have more control, even though in an abusive situation, they have more control over their own health habits, over their own medication, and over the needs of their children. So we're getting people where the options that we normally would be working with them, they're telling us that's not going to work for me now.
With a shelter house out, Brantley says her organization has fewer alternatives. One option is to help women draw up home safety plans.
Determining what's the safest room, trying to figure out what triggers this individual, remembering to stay away from rooms with hard surfaces like bathrooms and kitchens, hiding knives, being really hypervigilant, which really adds to the stress that everyone's going through, because at some level we're all hypervigilant about our own health, but being hypervigilant about their environment as well.
However, that kind of counseling can no longer take place in person. But that doesn't mean women in transition and organizations like it are unavailable to help survivors. The means simply have to change. But it's yet another hurdle to getting help.
Our office is closed, so we are operating remotely. Our hotline is still, operating our hotline. Women in Transition has a telephone counseling line called Lifeline that we're still able to operate remotely. So people are still able to call and get those services. What's changed the most is our individual counseling and therapy services, because all of those are now remote. They're either by phone or by text or by email, whatever is safest for the client. So it may just be a 15-minute check-in because everybody is home. So that's been challenging. And then what we're currently working on is virtual support groups so that we can resume our support groups that have been a tremendous support for our clients.
As Brantley says, support organizations can offer only Band-Aids right now. She says many callers in abusive relationships are reaching out just to make it through today, and they'll call again tomorrow to make it through again. She says that's okay. Sometimes counselors will advise simply writing a journal.
If they can do it safely, journal what they're going through, how they feel, and what they're doing about what they're going through, because this will help them after this is over to recognize the strength that they actually did have during this time. We work with them on some mindfulness and some grounding exercises, a lot around breathing and taking in positive thoughts and trying to let go of some of the worries and the concerns that they have. This is done on a daily basis, but helping them with some tools to calm themselves as best they can so that they can be a model for their children who are looking at them and wondering, we think our whole world is turned upside down. Children's worlds are turned upside down too.
And that's yet another difference in these times. Schools and daycare are closed. Yet many women feel it's unsafe to leave their kids at home, so they keep their kids with them all the time, even when they're on a call with a counselor. Normally, Women in Transition offers play care for in-person visits. Now they can't.
How can we support mom during this time with the children home? If mom needs to talk about the violence that's going on or the yelling and screaming that's going on in the household, how can we help her share that in an age-appropriate way with her children so that her children are feeling as safe as possible in this situation where none of us are feeling really safe?
Even before the pandemic, Brantley says there were always layers of trauma in domestic abuse. But with the nation on edge, now there's one more. But help is available. The National Domestic Violence Hotline is at 800-799-7233. The Women in Transition's Lifeline is at 215-751-1111. Or you can reach them for help or to help them at helpwomen.org. You'll find links on our webpage as well at radiohealthjournal.org. I'm Reed Pence.
With the threat of coronavirus, social distancing has become the new normal. But staying safe presents unique challenges for more than 5 million Americans living with Alzheimer's and more than 16 million family members and friends serving as caregivers.
Public health strategies aimed at limiting contact with others are nearly impossible for people living with Alzheimer's who rely on family caregivers and others every day.
Beth Kallmeyer is Vice President, Care and Support at the Alzheimer's Association.
For example, people living with Alzheimer's may forget to wash their hands or follow other safety precautions. Family caregivers need to be extra vigilant in helping individuals practice good hygiene.
Alzheimer's families also need to anticipate that current care, support, and communication options may change and make backup plans. And try your best to stay calm. People living with dementia take their cues from those around them. The Alzheimer's Association has more tips at alz.org, or caregivers can call its 24/7 helpline 800-272-3900.
Americans are taking sheltering in place seriously. During the week ending March 15th, when social distancing first started to take hold, produce sales were up 40%, and potato sales were up more than 72%. Columnist Produce by Pamela says that's because people are filling pantries for the long haul. Frank Muir is president and CEO of the Idaho Potato Commission.
Potatoes have a long shelf life, but as with any produce, it's dependent upon how they're stored. Potatoes should be stored in a cool, dark, dry place, but not in the refrigerator. The cold converts the starch to sugar, which creates a sweet flavor. Also, don't wash your potatoes before storing them, and don't store them near onions. Finally, if your potatoes sprout, that's okay. Just pick the sprouts off and your potatoes will be ready whenever you need them.
Staying in also means you'll need to cook with ingredients you already have on hand. You'll find recipes with that in mind at idahopotato.com. That's idahopotato.com.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.